Good morning, everyone, and welcome to Add Water and Stir, a conversation about adding dental sleep medicine to your practice. Cheers, Dr. G. This morning, in honor of National Donut Day, we'll be enjoying some treats from the local Southern California bake shop, Sugar Box Donuts. So, without further ado,
I'm Dr. Stephen Greenman.
And I'm Nicole Greenman. Together we run DSM Solutions, a coaching program for dentists, beginning to provide obstructive sleep apnea in their practices, and also for dentists looking to improve an existing dental sleep medicine practice. Today we're going to talk a little bit about how adding dental sleep medicine can help you improve your bottom line. We're also going to answer some commonly asked questions about how to get started and how DSM Solutions can help you.
A little bit about me. I'm a general dentist, just like most of you listening. I have a restorative, surgical, dental implant and cosmetic practice that I've had for well over 35 years. So I just started my journey on dental sleep medicine about 12 years ago, 2008. I attended a course at University of Southern California, a comprehensive course in dental sleep medicine, came back to my practice totally fired up to help my patients. And this is a life-saving service, life-changing service. So I was just so excited about it. Well, lo and behold, it took almost 2 years of fits and starts and trial and error and mistakes until I finally figured out how to make this run and really cook in my practice. I didn't have the tools, I didn't have the knowledge, I didn't have all of the systems in place to really make this work. And it was quite a journey. Well, after that, and after I became successful, I started sharing with colleagues who would ask me, well, how'd you do it? And so I started helping colleagues along the way. Well, my practice began to grow. And at this point, it's roughly 20 to 25% of my monthly production. And I found it so rewarding. My patients are just so happy. And we're here to share it with you.
I began my career in dental sleep medicine as a copywriter at a dental marketing company, and so many of the dentists that I was working with were really having difficulty making obstructive sleep apnea work in their practice. And I really wanted to help them not only provide a new menu item that was going to help their practices grow, help their private practice grow, but help them provide something that gave their patients a whole health experience in the office. So together we came up with the idea for DSM Solutions and set out to help dentists make obstructive sleep apnea happen for their patients and their businesses. So Dr. G, I'm sure there's a lot of questions that our viewers have. So without further ado, let's get through some of the basics. So I'm going to ask you some questions and you're going to answer them for our audience.
Okay.
How will dental sleep medicine set an office apart from the other dental practices in their area?
Well, that is a great question. And I've struggled with setting myself apart for my entire career. I used to think that it was just all about taking good care of people and providing quality care that would set me apart. Well, that really didn't come true, and I was very frustrated, particularly for the first half of my career, because I thought that that was the key. But how many of your practices are advertising cosmetic dentistry? Practically all of them. How many practices say that they're a warm, caring environment that listens to people? Well, all of them. You need to set yourself apart. Dental sleep medicine is an area that will do that and will create buzz for your practice. Also, it makes you a part of the medical community because in order to practice this at the highest possible level, you're going to be interfacing with your patient's physicians. Well, that's going to get you noticed and it's going to get you referrals from physicians. And how many of us wouldn't want quality referrals from physicians in our areas?
Great. Awesome. I'm sure a question that a lot of us have right now. Things have been pretty crazy lately due to a global pandemic. A lot of offices had to close and have been rethinking their goals for 2020. How can obstructive sleep apnea factor into those new game plans?
Well, as we know, the economy's taken a huge hit, and there are still many people that are unemployed or underemployed. The economy is most likely in a recession, and we don't know how long something like that is actually going to last. Well, dental sleep medicine is an area that can recession-proof your practice. During the Great Recession in 2008 through 2011, my cosmetic practice really took quite a hit. We were down probably close to 15 to 20%. Well, by 2011, we were up and having our best years ever. And why was that? Well, because we added this vital service that happens to be covered well by medical insurance, and we enjoyed a tremendous year in 2011. This is a way to recession-proof your practice, and doctors, you got to consider it.
Awesome. So how serious is this condition? How many patients in the average practice would be able to benefit from treatment?
Well, another great question. Studies show that up to 25% of the patients that are sitting in your reception rooms every single day that are going through your hygiene program, that are sitting in your chairs, doctor, have undiagnosed obstructive sleep apnea. Let's talk about snoring for a minute. Snoring in and of itself is never benign. Snoring is harmful. So you've got a tremendous load of patients that need your help. All you have to do is identify them and talk to them, and lo and behold, you're going to find a great deal of patients right there that are already in your practice that are prime candidates for this vital service. How serious is it? Well, I'm just going to quote from one study, and this is the Wisconsin cohort study, which is a widely quoted study. It's a prospective study. It looked at many health factors, not just obstructive sleep apnea, but the 20-year results on this study have been that severe apneics have a survival rate of only 60%. That means 40% of them are dead. Doctors, you can help. You can save lives, and you need to think about adding this service for your patients' sake, for the health of your patients, not to mention your bottom line.
Great. And how would I, the dentist, identify the patients that need my help?
Okay, so the way you're going to identify patients is pretty simple. You're going to talk to them, okay? You're going to look at their medical histories. So many of the common ailments or morbidities that morbidities, yes, that we see on our medical histories, like hypertension, diabetes, etc. They're all comorbidities with obstructive sleep apnea. And then you're going to talk to people. People love to tell you about their quality of their sleep, and so ask the question, how'd you sleep last night? Or tell me about the quality of your sleep. On a scale of 1 to 10, tell me about the level of daytime energy that you have. And then lastly, and Nicole, you need to come over and sit near me a little bit because you're half out of the frame. And then, lastly, ask about snoring. Ask about, are you able to sleep all night, with your bed partner? I mean, these are some of the complaints that we get. Also, you need to understand that dentists are uniquely positioned to recognize the clinical signs of sleep apnea. The lower third of the face, this part of the face, full on and in profile, will tell you a great deal about the airway, also the size of the neck. So you're performing essentially a sleep apnea exam every time a patient opens their mouth. You just don't even know that you're doing it. So all you have to do is learn, and you will see just a tremendous amount of patients that could use your help.
So what are the treatment options for obstructive sleep apnea? You've identified your patient. What's the next step?
Well, treatment options. The gold standard treatment option, Nicole, has been the CPAP. The problem
Absolutely.
with the CPAP is that it's quite a stigma for most people to wear it. It's
I wouldn't wear
uncomfortable.
one.
Look, I talk to physicians all the time that tell me I wouldn't wear one, and they come to me for oral appliances. So, doctors, your medical community doesn't like this thing very much either. And one of the main reasons they don't like it is that the acceptance rate or the compliance rate after a year is under 50% with CPAP, and those that are considered compliant aren't really using it very much. So other options that have come about over the years, of course, have been surgery. I don't know if you maybe are an older doctor like me that remembers the palatal surgery called UPPP. It was very popular in the 90s and on into the 2000s. Well, the problem with almost all of the surgeries is A, they're invasive, and B, most of them don't work. We have the best product on the planet for treating obstructive sleep apnea. Study after study shows that our service with oral appliance therapy is not inferior to CPAP in controlling a large number of health factors, quality of life factors, the list goes on and on. So it's easy to do, too. Your job as the dentist is to deliver the appliance and manage the patient going forward.
Speaking of managing patients going forward, tell us a little bit about what a typical day of OSA looks like in your practice. Who's talking to the patients, leading the appointments, and closing the deals?
Well, everybody in the office needs to talk about sleep apnea. Anybody who has
Absolutely.
contact with your patients needs to be able to talk about this. So that means that the whole team needs to be on board in the boat and rowing in the same direction. I think that that's just a critical part of this. It has to be part of the culture of your health care practice that you have, because we are healthcare providers. So, with that out of the way, one of the most rewarding parts for me I just turned 64 this year, is that it allows me to see fewer patients, to concentrate more on the dental services that I really enjoy, so I'm not toiling away in my practice. My back no longer hurts, my neck doesn't hurt anymore, and my hands typically aren't particularly sore at the end of the day, because we have this other aspect of our practice that provides this dental sleep medicine. Your team that helps you to do this will find it very rewarding. Most practices that do well with this will have a particular point person in their practice that is the main interface with your patients. All of the technical procedures, let's say, that need to be done can be delegated, okay? Doctors, all you really have to do is use your mind and give directions for follow-ups, for adjustment of appliances, etc. But in our practice, our main office administrator, Lisa, runs this. And she has really, she really owns it, okay? She just feels empowered by it, because this really makes her a primary healthcare provider rather than just a secretary or a spit sucker like a dental assistant. So this is a part of your practice that I'm sure that you will have team members that are just going to love. And so a typical day in my practice, long story short, okay, or short story long, okay, whatever, I'm able to spend a lot of time with my dental patients, follow up with my dental patients. I'm not feeling rushed to complete procedures, and we can have this other adjunctive part of our practice, like I said, 20 to 25% of our production, that doesn't involve my two hands. It's the only part of our practice that does produce without these working in the patient's mouth. So I just can't stress enough how great it is to have this in our practices. So
Awesome. Well, that's all fun and games, but a lot of offices ask us about medical billing, medical insurance. That's a big perceived barrier for a lot of offices. So how do you mitigate some of those problems with insurance companies to get your money?
okay, well, when I was first starting out. This was a mystery, a very mysterious part of putting all of this together. I started to work with a third-party medical biller, and I would encourage, and we help our clients to do that as well. We even have a medical biller that we don't have any ownership interest in, who we've worked with for, how many years have we worked with this?
Oh, I think 7 at this point.
Okay, and so we've got a few medical billers actually that have been working with us for many years. So we've vetted them and qualified them. It seems like, at least to me, there was a lot of moving parts when I was first starting out, but the reality is that medical billing is quite simple. There's just like 5 simple steps that you follow, and you don't have to call the insurance company yourself. Everything gets either faxed or emailed over to your medical biller. Okay, any questions or any requests for documentation that comes back goes through your medical biller. Your medical biller stores all of the documentation. So if you ever get asked questions down the road, you turn it over to your medical biller. If, for example, you get some kind of a denial, which can happen. I mean, it does happen. I mean, all of us that have had experience with dental billing know that these insurance companies are out to not pay you. Well, your medical biller is motivated to collect the most possible money for you and your patient, because that's how your medical biller gets paid. I'm a big advocate in having medical billers that work on a percentage, although for doctors that are uncomfortable or don't want to do it that way, we also have access to medical billers that will work for a flat fee. So medical billing, it seems like a daunting challenge, but in reality it's not. After a few cases, it'll just seem so easy, and you'll just have your systems down. And of course, that's what we're all about, helping you to do that.
Yeah, well, how can DSM Solutions help an office start treating OSA or even improve an existing obstructive sleep apnea practice?
Well, we've been in business now since when, 2011?
2012.
2012, the beginning of 2012. Okay, so we're well established, and doctors, if you consider doing this, and I encourage you, look at other programs. I think you're going to find that that we're really different, because we're a mentorship-based program. We can help offices at all experience levels, from a novice dentist who's had absolutely no training, all the way to a well-trained dentist that, like me, had a lot of problems putting the whole thing together and needs help on that level. So whatever level you're at, we're going to take the time to sit down, talk to you, find out what your goals are in your practice so that you can make it happen. Additionally, I'm a diplomat of the American Academy of Dental Sleep Medicine. I'm well versed in the process to become a diplomat. I encourage all of my clients to become diplomats, because also that's another way to distinguish yourself, to set you apart from other dentists who might be advertising this service, and also make you much more desirable to the physicians in your community. So all of our training is live, okay? Just like we're sitting here live with you now. We do not have you sit through pre-recorded lectures for training. It's web-based, okay? There's no travel for you, the doctor, no travel for your team. So there's a tremendous cost savings in that, and also with COVID and all that, not too many people want to travel and assemble, in a room to hear lectures right now. So we've been doing this already since 2012, all web-based and live. So we're very experienced with that. Also, doctors, you have a question, you have a case, you have maybe a complication that you don't know how to deal with exactly. All you have to do is, push my button on your smartphone, and generally I'm able to pick up the phone, and if not, I'm calling you back real soon. And for your team, Nicole is doing this full time, so she's always available.
Absolutely. Something I'd like to add is that all of our trainings are geared towards you and your team. All of our offices are different, we recognize that, and in order for you to be successful, We're going to put together a game plan that fits you, the members of your team in your area, in your community, because we want to see you guys really make this happen. So, to learn more about DSM Solutions, our programs, or set up a complimentary consultation with myself and Dr. Greenman, please reach out to us on Instagram at DSM Solutions CA, on our Facebook page, DSM Solutions. You can look us up online at our website, dentalsleepapneatraining.com, or shoot us an email, which I get personally to my computer. I will answer you immediately at info@dentalsleepapneatraining.com. So with that, everyone have a great morning. Again, reach out anytime, ask us questions. We're really looking forward to hearing from you.
We have to do this again.
Absolutely.
Well,
maybe with different treats next time.
Different treats, and maybe we'll focus on, I don't know, how about developing patients and enrolling patients?
Sounds like a plan. See y'all next month.
Okay.